Are you confused about the difference between HOMA-IR and HbA1c and which one actually matters for your health? Both tests give us a window into metabolic health, but they're looking through completely different windows. And knowing the difference could be really important if you're trying to understand your diabetes risk. Let's start with HbA1c because this is the one you're most likely to encounter through the NHS. HbA1c reflects your average blood glucose over the past 2 to 3 months. It does this by measuring how much glucose has attached itself to the hemoglobin in your red blood cells. The higher your average blood sugar, the higher this reading will be. In the UK, it's measured in mmol/mol, and it's the NHS standard test for both diagnosing and monitoring type 2 diabetes. Under NHS and WHO guidelines, a reading of 48 mmol/mol or above, confirmed on a second sample, meets the diagnostic criteria for type 2 diabetes. A reading between 42 and 47 mmol/mol indicates non-diabetic hyperglycemia, sometimes called pre-diabetes, meaning blood sugar is higher than it should be, but not yet at the diabetic threshold. It's worth knowing that HbA1c isn't reliable for everyone. If you have a hemoglobin disorder, hemolytic anemia, advanced chronic kidney disease, or if you're pregnant, have had a recent blood transfusion, or are a child or young person, HbA1c results can be misleading. In those situations, your doctor may use a fasting plasma glucose test or an oral glucose tolerance test instead. Now, HOMA-IR is quite different. It's a calculated score worked out using your fasting insulin level and your fasting glucose level together. What it's trying to estimate is insulin resistance. That's when your body's cells stop responding properly to insulin. The reason this matters is that insulin resistance can develop years before your blood sugar actually rises. So in theory, HOMA-IR might flag a problem earlier than HbA1c would. But here's something really important. HOMA-IR is not a standard NHS diagnostic test. It's not part of routine NICE clinical pathways. You're much more likely to encounter it in research settings or specialist clinics. There's also no universally agreed cutoff value for clinical use in the UK. Research literature sometimes references values above 2.0 to 2.5 as a signal worth noting, but these figures are population-specific, lab-dependent, and cannot be applied universally. Please don't self-diagnose or act on a single HOMA-IR value. Interpretation must always be done by a clinician who knows your lab methods and your overall health picture. So the two tests aren't interchangeable, they're actually complementary. HbA1c reflects sustained changes in blood glucose, which typically occur at a later stage of metabolic deterioration. HOMA-IR looks at how well your body is managing insulin at an earlier, deeper level. Neither should be interpreted in isolation, and both need to be considered alongside your full clinical picture. So, what should you actually discuss with your GP? If you have risk factors for type 2 diabetes, things like a family history, excess weight around the middle, or a previous diagnosis of gestational diabetes, it's worth asking about having your HbA1c checked as part of a routine health review. If you're already in the non-diabetic hyperglycemia range, ask what monitoring and lifestyle support is available to you. And if you've had a HOMA-IR result from a private test or a specialist, bring it to your GP so they can interpret it in the context of your overall health. If you're experiencing symptoms like increased thirst, frequent urination, unexplained fatigue, or blurred vision, please do speak to your doctor promptly. These symptoms warrant proper assessment. To recap, HbA1c is the NHS standard test for diagnosing and monitoring type 2 diabetes. HOMA-IR estimates insulin resistance and may detect early metabolic changes before blood sugar rises, but it's not a routine NHS test and has no universally agreed clinical cutoff. They measure different things, they complement each other, and neither should be read in isolation. This video is for general information only and does not replace medical advice. Always speak to your GP or healthcare professional about your own results and individual situation. If this helped you make sense of these two tests, leave a comment below and subscribe to the Bolt Pharmacy channel for more medically accurate health information.